Hi, and welcome to the third training of Silver Care. This training is going to cover your first visit with your client that you have been assigned. Remember that you accepted the case via the website, however, all the documentation for the client will now be on the app. You can download the app either onto your phone or by the computer. When you log into the website, you can click Install App, which will download the app onto your computer. At the first visit, you're going to be having your client sign a release form besides for the SDD form that they sign every visit. Before this visit, you are going to print out that documentation for them to sign. After the visit, you will be entering in a plan of care, and this video is going to cover both. Let's begin with printing out some documentation. Here I have the app open, and I am going to log in to my TherapyBOSS app on the computer so that I can print out some documentation for me to get signed by my first visit. I am clicking Login, and I am going to go straight into Patients. In my Patients, I'm going to click Test 2, and I'm going to go first to Demographics, which is where I find out all my information about the client themselves. Here you are going to view the attached paper document. I'm going to click on the PDF, and it will ask me to open my PDF, which I will then open up, and it will bring me up to an SDD form. This SDD form will be printed. How that SDD form is signed was covered by actually a different video, so we're not going to cover that now, but you will print it out, you will have it signed, and you've had it ahead of time. Now, this is where you will always find your SDD forms will be under the client's name by demographics. It will be in View Attached Paper Document. You will now look to documentation, and you will have two CNs available to you. Each of these CNs is a different document that you're going to need signed by that first visit. So you're going to open it up and see that there is a magnifying glass. You will click on it. It's going to have a PDF there. One of them will look like this, and again, I'm going to click Open, and it will look like this. This is called the Rights and Responsibilities of Silver Care Agency. You will fill out the client's name. After you're going to print this out, but at the session you would fill out the client's name, the date of birth, and then on the bottom here, the signature of the client, the date, the signature of the parent, and if there's a translator, a signature there. That's the first CN that you're going to be printing, and then the second CN that you're going to be printing would be, again, you click on the PDF, and that one is called Authorization to Release and Exchange Confidential Information. This allows you to speak with us, with the care manager, etc. So you would fill out the client's name and have them sign on the bottom with their social security number or their date of birth, and then your own signature here as well. Now, both of these forms need to be signed by the first session. It should be mailed in with your first SDD form. Following that, you will only be mailing in the SDD form. We are now going to discuss the plan of care for the youth. Now, this can be done with the patient and discussed with them either on the first visit, or the second visit. So, in this case, we are going to open up the youth, and we are going to do a non-visit document again. Now remember, this is with the sometimes with the client there, and you're going to choose plan of care. You are then going to click Save, and it will give you a few different things that you're putting into your plan of care. The first one is the diagnosis. So let's say, for example, you're going to have a generalized anxiety. You're going to put in whatever you feel the appropriate diagnosis is. You're going to add it by the plus button. You're going to click OK. And now you go to Care Plan Goals. Over here, you're going to go to these three dots on the side. You're going to click on them, and you have all the different options here of different pieces that may be coming up in the session. In this case, we're going to click Anxiety, and you have different goals for anxiety. Over here, let's say you also have an ARC-RO case. You may add some of the goals. ARC-RO has many different goals. You will choose with the family which ones they feel are important to them. You will click OK. Click OK again. You're now going back to the care plan intervention. So before we had goals, now we're going to look again at the three dots We're going to choose from anxiety. So we would choose what interventions we're going to use for anxiety. And if you're also doing ARC-GROW, you would choose which interventions you're going to be using for ARC-GROW. Again, there are many different options to choose from. You will click OK. Click OK. So you have your diagnosis, your goals, your interventions, and now you're up to your visit frequency. This is a very important piece. Please put in your intended frequency for the 12 weeks. This is a great time to open up the conversation with your client in order to keep consistency, to say, do you want to meet once every week for 2 hours, or do you want to meet twice each week for 1 hour each? It is very important to keep consistent sessions in order for us to get the clients the help that they need during this small time that we are with them. So you are going to set the frequency for this episode. If you make up with the client that it is one time, it's weekly that you're setting it. If you make up with the client that it's going to be one time, you would do a plus and you would repeat it for, let's say, 12 weeks. Assuming it's an ARC-GROW session, it would be for 12 weeks. You would click OK, and then you're going to click Save. Then you're going to click OK, Save again. Is this document ready and complete and ready to be submitted? Yes, it is. We now have our 2 CNs, which we got signed at that first session. We have our plan of care, okay? And the very important part here is that we now need to synchronize, okay? Please keep in mind that you will never be able to see info that we send you, and you're never going to be able to, we're not going to see your info until you synchronize. So whenever you see the green thing on the top over here, that means that you have new information that needs to be synchronized. So you would click synchronize. It's very simple. It takes under a minute. You would click send and receive. It's going to say sending, receiving data. Takes, like I said, around 60 seconds, and then you are done. You have your 2 saved documents. You can always go back into that demographics to find your STD form, and you have your plan of care completed. Thank you for watching.